So today I wanted to start a three-part series about sinus surgery. Most people try and just live with chronic sinusitis for years. Constant congestion, facial pressure, drip, infections, and they're not sure when it's time to consider sinus surgery. So a new plain language summary from the American Academy of Otolaryngology gives guidelines that really help outline the clear way to think about it. So these are the real ENT experts telling us what the research shows. Sinus surgery isn't the first step. It's for patients who have persistent symptoms that continue despite good medical therapy. So that includes things like nasal steroid sprays, saline rinse, allergy control, and sometimes antibiotics or a short course of steroids. I usually recommend 21 days of an oral antibiotic and allergy testing when indicated. What the guidelines emphasize is that surgery becomes appropriate when the inflammation keeps blocking the sinus drainage pathways even after these treatments. And that ongoing inflammation shows up in two places. Basically, the symptoms you feel and what we see on CT imaging or on endoscopy. So in other words, it's not just how you feel, it's what your anatomy and the inflammation are doing behind the scenes. So the big takeaway is that sinus surgery isn't meant to cure everything, but it does open the natural drainage pathways so medicines can work better long term. It's a partnership between surgery and continued medical care. So if you've been struggling for months or years and medications aren't moving the needle, these guidelines show that it might be time to at least talk to an ENT about the next steps. You don't have to live with congestion all the time. There are real solutions. I'm Dr. Morgan Yost, giving the real world info on sinus surgery, and follow along for part 2.